Hi, in this lesson, we'll be looking at the pharmacokinetics and bioavailability of drugs. Pharmacokinetics is basically the study of what the body does to the drug. After a drug is administered, it has to be absorbed into the blood. Through the blood, the drug is then distributed to the rest of the body. The body also eliminates the drug through metabolism and excretion. These four processes are summed up as ADME: absorption, distribution, metabolism, and excretion. For example, after an oral drug is administered, it is absorbed from the stomach and small intestines into the blood circulation. Through the blood circulation, the drug is distributed to the rest of the body. The drug is metabolized in the liver and excreted by the kidneys into the urine. Some of it could also be excreted in the feces. It's important to know the pharmacokinetics of a drug to find out the best way to deliver it to the body. The drug industry spends about a quarter of its research budget for a new drug on pharmaceutics. Pharmaceutics is the formulation of a drug to ensure that the drug can be effectively absorbed, properly distributed, and remains at the site of action long enough to produce an effect. The goal is to ensure good bioavailability of the drugs. Bioavailability is the rate and extent to which a drug is absorbed and becomes available at the site of action. Since pharmacokinetics is so important, let's take a closer look at the ADME processes. Regardless of the route of administration, systemic acting drugs cannot work unless it enters the bloodstream. So, from the site of administration, drugs will need to cross cellular membranes until they reach the circulatory system to be distributed to the rest of the body. How quickly the drug can be absorbed affects its onset of action. This is important especially for drugs that need to work fast in emergency situations. How much of the drug is absorbed will affect the extent of drug effect that is experienced by the patient. There are many factors affecting drug absorption. For example, in an oral solid dosage form, the rate of disintegration of solid dosage form affects the rate of absorption. The rate of disintegration is affected by the excipients that are used, as well as the manufacturing process. After disintegration, the disintegrated particles need to dissolve before the drug can be absorbed. The rate of dissolution is determined by the physical and chemical properties of the drug itself. Environmental factors at the site of absorption also affect absorption. For example, pH of the gastrointestinal tract, the presence of enzymes which may degrade the drug, and any interaction with food or other drugs that are taken concurrently. After absorption, the drug must be distributed to its site of action in order to exert an effect. For example, if a drug is meant to treat meningitis, which is an inflammation of the membranes covering the brain and spinal cord, then that drug needs to be able to reach the brain and spinal cord. Drugs in the blood are distributed via the systemic circulation to all parts of the body. However, drugs are not equally distributed to all tissues because of the different drug affinities to different tissues. For example, some drugs may stay mainly within the blood, whereas some drugs tend to accumulate in the fat tissues. Drugs in the body undergo metabolism, which means that they undergo biochemical modification or degradation, usually through specialized enzyme systems. The liver is the primary site of drug metabolism. The liver contains many metabolic enzymes, such as the cytochrome P450 enzymes, which are well known for their role in drug metabolism. Besides the liver, drugs may also be metabolized in the intestine, kidney, lung, and skin. The goal of metabolism is usually to make the substance more water-soluble so that it can be more easily excreted from the body. Usually, the active drug is converted to inactive metabolites. However, sometimes the drug is converted to active metabolites, which can exert a therapeutic effect. Some drugs are intentionally administered as inactive prodrugs, which are metabolized by the body to form the active drug. For example, Codeine is used as a painkiller. Codeine itself is not active as a painkiller, but in the body it is converted to morphine, which is a strong painkiller. For drugs that are metabolized by the liver, the dosing regimen may need to be adjusted in patients with altered liver functions. For example, those with liver diseases, the elderly, and young infants. Finally, the drug must be excreted in order to completely get rid of the drug from the body. Earlier on, we saw that metabolism usually converts the drug to be more polar or water-soluble so that it can be easily excreted. Most drugs are excreted through the kidneys into urine. Other means of excretion are through the liver as bile, from the intestines as feces, exhaled through the lungs, and excreted through body fluids such as sweat, saliva, breast milk, and tears. Since the kidneys and liver are responsible for the excretion of drugs, changes in kidney and liver functions can affect excretion. Urine pH may also affect excretion of drugs. For drugs that are weak acids or weak bases, their extent of ionization is affected by pH. In the ionized form, these drugs would be more water-soluble and therefore more easily excreted in the urine. Excretion may also be affected by other drugs that the patient is taking concurrently. For example, probenecid reduces the excretion of penicillin. The faster the metabolism or excretion of a drug, the less time it will remain in the circulation, and therefore less drug will be available to the tissues. The half-life is the time required for the amount of drug in the blood to decrease by 50%. Take a look at this example. At 2 hours, the drug plasma concentration is 8. After 2 hours, the drug concentration is halved from 8 to 4. After another 2 hours, the concentration is half again from 4 to 2. So in this example, the half-life of the drug is 2 hours because it takes 2 hours for the drug concentration to be reduced by 50%. Drugs with shorter half-lives are eliminated faster compared to those with longer half-lives. Therefore, drugs with shorter half-lives may require more frequent dosing. To sum up the section on pharmacokinetics, when a drug is administered, it undergoes absorption, distribution, metabolism, and excretion.